Hello, good afternoon. It is Mental Health Awareness Week. We're gonna go find Pixie. Hey Pixie! Here she is, look! Hi! Hello. So I think mental health awareness is probably something people are very aware of at the moment, given recent circumstances. I'm sorry about the wind. Come on, Pix! I mean, before all this happened, mental health services were pretty underfunded anyway, so I mean, now that this has happened, but it's worth mentioning of how far we have actually come as a society in terms of mental health and what we think of it and what it means to us. You know, if you look back 100 years ago, women were thrown in asylums for postnatal depression. People that were having panic attacks were strapped to beds. They thought they were possessed by demons. Men were coming home from the First World War with shell shock. We know that now as PTSD. Where are you going? We do live in a world now where science does validate our disorders, you know, and there is effective treatment. Even if only a few can actually get that treatment, it does exist. I guess as well I'd like to talk to you about suicide as well. Now I can only speak from my own personal experience, and I know some people look at suicide as a selfish act, and I suppose there would be some legitimate arguments for that, but personally, when I'm suicidal, I feel like a burden to people, and that by removing myself from the equation, I'm unburdening my friends and family. Now I know that in reality that's nonsense. Oh, it's windy, rainy. Come on, quick. Go, that's it, go on, that's it. I've let the babas in, because I don't want them following me where I'm going, because I'm going to show you something. I want to share something with you that's important, and demonstrate why it's important that we talk about mental health. This is just behind my house. My house is just over there. Well, about 2 weeks ago, I hit crisis point. I just completely and utterly spiraled, and I walked out to this bridge. So a very, very dark cloud was over me. 1 minute I was fine, something triggered me, and then that was it. I was suicidal. I walked out to this bridge and I looked over this side and I was crying, just completely and utterly helpless, just completely helpless. I had no self-worth. And then I remembered that my mum and my brother made me promise that they would never have to attend my funeral for something that I've done to myself. And 2 weeks ago, when I was stood on this bridge, I remembered that promise, and I'm still here today. I live in Leeds. My mum lives on the Wirral in Merseyside, and my brother lives in Australia, and they saved my life. You know, my brother's on the other side of the planet, my mum's miles away, and they were in here and they saved my life. But that's because I feel comfortable to talk to them about my neurological disorders. If I wasn't comfortable talking to them, who knows? Come on then, Kovu, come on. Ah, good boy. There was a time I would wish to be normal, or what I know now as neuro-regular. But now I couldn't lose my my disorders. Yeah, it's a gift as well. I can remember being very, very young, 7 or 8, and trying to take my own life, and I didn't understand why. I just remember the pain, wanting the pain to stop. So since I was a kid, I mean, for a lot of people, since you're very young, you notice these things, and you sort of notice you're a bit different, and that other people seem to do things that you can't. But also, you can do things, you can see things that others can't as well. It's given me a tremendous gift of empathy, one I've not always understood. Come on, Kovu! You know, when I was a kid, I'd have given anything to hear an adult say that it's okay to be different, to describe the things that I was feeling, and it would have certainly helped me feel less alone. So that's the motivation behind these videos. I feel like a bad person to give advice, because I barely look after myself as it is. But if I was to give any advice, and especially right now, is that you try and do small things every day consistently. So brush your teeth, a wash, you know, maybe read, and then anything else that you do after that is a bonus, because you've surpassed your expectation. You're not setting yourself up to fail. Is it windy, Kovu? Hello, pigs, is it windy? This isn't a normal circumstance, this isn't a normal situation. You're allowed to have bad days, you're allowed to have a bad week, a bad month or whatever. Survival is survival, and everyone's survival looks slightly different. Small things consistently every day seems to be the way forward. It's normal to not feel normal at the moment. What's that? Come on in, hey! Come on in, come on, good boy! Here goes Pixie! Come on, Kovu! So thank you very much for watching. If you feel this could benefit one of your friends or anyone you know, to make them feel or help them feel a little bit less alone, and yeah, share it with them. But thank you very much for watching, guys. Stay safe. We can't wait to see you all very soon. All right, see you later. Say bye, guys. Good boy.